So I'm here with Robert Ruffer, my buddy Robert, and Robert, you had a little faux pas a few weeks ago, buddy.
Yeah, I cut my arm off about 5-6 weeks ago now. I had it reattached by a magical doctor at U of M, and I can move my arm now. I can move my fingers, I can make a fist, and I can go like this. And I was able to get off the pain meds about 2 weeks ago now, thanks to my buddy John here, who brought me over a TENS unit, and it allowed me to attach it right here and here, and I put it on a very low electrical impulse, and it was able to mitigate the pain so that I could sleep without taking painkillers. Not taking painkillers is really important so that you feel better and you don't feel unstable when you're walking. You know, the last thing you want to do at a point like this in my recovery is to trip and fall and have the titanium plates get messed up again. And then you came over and gave me this TENS unit, and it was able to get me, that's what took me off of the Oxycontin and Vicodin completely. Imagine that, I was on Oxycontin and Vicodin simultaneously. Those are very, very strong drugs, individually, let alone combined. I wasn't even doing anything terribly important. I wasn't measuring or nothing. I was just blindly cutting wood, aimlessly doing idiot work and not paying attention. My sleep got caught in the sauce.
Yeah, that fast, man. That fast, game changing.
Change in a second. It was less than a second.
Yeah.
And I'm just happy to not have passed away. I was able to keep my composure and run to the house. My son came out and called 911. For a second, I thought he wouldn't give me his belt because it was a Gucci belt. But he did yield the belt, and I wrapped it around, put a tourniquet on, and I put my arm up against the post for the carport, and I had my son, Randall, hold it on the other side, and I told him, I said, Randall, you need to pull on that like your life depends upon it, buddy, and he did. It was the first time I felt pain, was putting a tourniquet on. If anybody was going to be able to take good care of me, it would be those men and women at U of M, and they put my arm back on.
Pretty sweet.
So,
and they did a damn fine job. We're going to go test drive it at lunch. See if you can have enough dexterity to hold your silverware.
I was on the tractor the other day moving around some dirt, and I was able to use this hand and use the suicide knob to turn the wheel around in the tractor. And you know, I'm not allowed to do a whole lot of stuff, but getting on a piece of equipment is not dangerous for me. So I'm able to feel like I can get some stuff done.
Really cool.
It's important to keep active. I get on a treadmill about 8 miles, 9 miles a day, on a recumbent bicycle rather. I've been drinking 120 ounces of water, taking all my vitamins, no smoking, no drinking, no caffeine, no coffee, no chocolate. Apparently that shrinks your capillaries, and I wanted the best blood flow there. I'm still at risk for another 5 weeks or so.
And that's a cool point. My buddy, Dr. Robert Windsor, a pain practitioner, nationally renowned out of Atlanta, he was commenting, he actually used a TENS unit after his hip replacement surgery, first and second. And one of the impacts, one of the effects that he advocates you get from that technology is it actually can stimulate some of the capillary growth. So when you're trying to
increase blood flow,
right, grow your arm back on,
yeah.
that can be damn handy.
I think it's important to have good, what they call perfusion, and that's the oxygenation of the blood going to that area. That's why I get on the exercise bike for 40 minutes a day.
But anyway, the TENS unit, you're using it after your therapy, and then you use it when you go to bed.
Well, I'm using it actually for therapy.
Oh, cool.
I use it for therapy where my tendon is attached to the origin of the tendon starts here. And what it does is that the TENS unit on a higher charge will pull this muscle and pull this muscle, and what it's doing is it's elongating the scar tissue. So the scar tissue isn't as condensed or doing a keloid interior. So in that TENS unit, elongates the tissue so that the tendon will be able to slide through. Try to maximize all the positives and minimize all the negatives to increase my chance of being able to keep this hand on. I'm still at risk if there's a terrible infection that becomes me. I still have the potential to lose my arm. So I don't come outside much. I stay inside away from the animals and the horses, and we have chickens right over there.
Yeah, no bird flu on your recovering wrist. We'll take a couple shots of Robert's property because he's an amazing artist. And apparently with the progress he's making and the diligent efforts that he's putting forth, retooling the limb, he'll be back at it in not too long. So very cool. All right, let's go eat lunch. The bottom line, there's other ways to get through that period of weaning yourself from the opiates, which in an injury like this are necessary.
Right.
Post-surgical realm are necessary. But if you don't get off them, I mean, I've got a friend that's a physician, we've had conversations, I've seen him cry at dinner getting a phone call that a patient killed himself because it happens. And if you are not successful in figuring out other alternatives to mitigating that pain during this rehab process and after that first few weeks, and I don't need, I'm not a physician, I don't need this physician to tell you this, but I've been through some pretty significant rehab events. Surgeries, knee surgeries, the ankle reconstruction, collarbones, I break a lot of things and kind of hurt myself. But
maybe I should give you a glass of coffee.
I'm okay with this. All right, that's perfect. That's a great way to end too. That's that piece.
A Grosse Pointe hairstylist back to work after nearly sawing off his own hand.
Yeah, an incredible story. Doctors at U of M reattached it, and he is calling it a medical miracle. And now Detroit's Kristen Pierce shows us why.
It was cut from here all the way over to here, and so this flap of skin here was all that was left.
Robert Ruffer was cutting up scrap wood outside his barn when his sleeve got caught in the saw.
My hand got cut really bad. I try not to say the word amputate anymore.
Because the injury was so bad, Robert almost had to get an amputation, but he was determined to keep his arm, and so were the doctors at the University of Michigan Hospital. They stitched and stapled him up, and now he's good to go.